Hello everyone, welcome to SCube TV. I am your host Rajni Bharara. Today on the show I have with me Dr. Syed Nusrath and he is a cancer surgeon. And today on the show we are going to speak with him about breast cancer. And but before, let's welcome him to SCube TV and also to the show. Hello, Dr. Syed Nusrath. Welcome to SCube TV once again. It's a pleasure having you on the show back.
Thank you very much. Good evening. Nice to see you again. I hope you're enjoying this.
I mean, up till now, I am enjoying it, and I'm so sure that this episode is going to be a really interesting one and really informative one. Because, like I mentioned in the beginning, that at the show, the topic of today's discussion is going to be breast cancer. So today we are going to educate our audiences more about this subject and more about this topic, because it is a very important topic of discussion. So, Doctor, without wasting any time, shall I ask you my very first question? So my first question to you, Doctor, is if you can please explain, how does breast cancer happen?
Whenever you label a patient as a breast cancer, the age is from 20 years to 80 years. In this age, any lady, any girl, or any elderly people can suffer from breast cancer. The first and the foremost symptoms, like complaints, what the patient says is the patient has got a lump in the breast. There will be a small lump in the breast. It may be in the right breast, it may be in the left breast. That is the first. Second thing, patient may say that the patient has got a discharge from the nipple. These two symptoms are the warning symptoms for cancer of the breast. Whenever a patient comes, whenever a lady or a girl comes with this history of lump in the breast, just unless and otherwise proved, it is supposed to be a cancer. So that is the first and foremost. Lump in the breast, discharge from the breast, go ahead and think that it's a cancer of the breast. Then you start investigation of the patient.
So, Dr. Fariz, also I would like to know from you, you actually mentioned that if you are going, if you are thinking that you are having breast cancer, so there must be a lump in the breast. So when talking about lump in the breast, it also happened that when a woman goes through her menstruation days and those period days. So before that actually happens, PMSing also happens before the actual menstruation. So I would like to know from you, when the hormonal changes in our body happen. So, a lot of, she goes through a lot of changes, like pimple in her skin, and then stomach ache and body ache, and then mood swings. And also it happens that in her breast also, the breast gets either firm or tender. How can a woman differentiate that this is not a hormonal change that is going in her body, but it is rather a very serious issue or a problem that might be going inside her?
Very good question, Rajni. See, what happens in especially young girls, puberty girls, what happens is the girls during the menstrual cycle, that is, we call it the premenstrual or the postmenstrual time, the patient will have heaviness in the waist, pain in the abdomen, the patient will have pimples, acne, and then she feels heaviness, or she can feel a lump in the breast. So this is not cancer. You can reassure them, this is known as fibroadenosis. In the breast itself, there will be a growth of the tissues, which will mimic exactly like a cancer, but this is not cancer, especially a young girl who is not married. So this is known as fibroadenosis. So whenever the patient comes to a doctor, or she asks her mother or sister or elderly people, you should say, just wait until your menstruation gets subsided. So once the menstrual cycle is over, this automatically goes off. So you don't have to worry. If at all it continues after the menstrual cycle, you have to be alarmed and think probably this could be a malignancy, unless and prove otherwise. So this is known as fibroadenosis. Just wait and watch policy for that 1 week and 10 days period is very, very important. Just have some B complex, just have some painkiller, and then it will subside.
Dr. Farid, also, while a woman will be examining herself and her breast, that whether, is it a lump or it's just a hormonal change that is going in her body. So whenever she'll be examining herself, so how can she differentiate? If I ask you, how will the lump or the hormonal change?
The most important thing is this is known as the self-breast examination. Mm-hmm. Self-breast examination is She herself, when she's taking a bath, whenever she applies a soap, she can feel it nicely, and always examine both the breast. That is the first and foremost. Don't examine one breast, and especially once she's out of her menstrual cycle. That is the foremost thing. She applies soaps and then she examines and it slips. So if you have a firm lump or if you have a hard lump, 100% it is known as cancer. If it is a firm and it moves within the breast, which is known as breast mouse. So this is not cancer and it is known as fibroadenoma. So now we have fibroadenosis. Second one is the fibroadenoma, and the third one is the cancer of the breast. So this fibroadenoma will be moving all over in the breast. So this is again a benign condition and it's not a malignant condition. So here again, you cannot be afraid of this thing. The most important is in this young girl or elderly age group, if at all the patient has got a lump and then the patient has got bleeding from the nipple. This is very, very important. Once there is a blood coming out from the nipple, you should be alarmed. You should be very, very careful that this is not a normal benign disease. It is a cancerous disease.
Dr. Farid, also can the breast cancer, the cancer happening in the breast, can that also spread to other organs in the body?
So now this is known as the stage of the breast disease. So whenever the patient comes with a lump in the breast, by the time she identifies the breast, get it proved, then we call it as a fine needle aspiration cytology or true cut biopsy. We do it. So once you do that, by the time it is known, then it becomes inoperable. That will be the stage 1, stage 2. That is how it keeps on increasing. So that time, what you are supposed to do is you are supposed to identify the disease. You have to send it for histopathological examination, and then it comes as cancer. So once it comes as cancer, this is early stage. It is divided into 5. TIS in situ, you don't have to bother, then T1, T2, T3, and T4. The most difficult for the treatment is stage 4 disease. That is known as a large stage disease, that is a T4 disease. It depends on the size of the lump in the breast. It can be 2 centimeters, can be less than 2 centimeters, can be 2 to 5 centimeters, can be 5 to 10 centimeters, and it can be more than 10 centimeters. The more the size becomes, the more complicated it is. The more skin involvement it involves, the more complicated it is. So once you are examining self-breast examination, you have to put your hand in the axilla and in the supraclavicular region and see whether there is a spread. That is known as the spread, which is known as the lymph nodal spread.
Okay.
Now the breast cancer spread through number 1, lymph node spread, number 2, blood spread, and number 3 is the direct spread. So all these things should be known so that the lump will be in the breast, but it will go to the liver, it will go to the lymph nodes, it will go to the ovary, it will go to the lungs, and it goes to the brain also. So that is the most important thing. You find a lump, you identify a lump, you contact a doctor, do self-breast examination, do a biopsy, and then you come to know there's a cancer. It is curable. Now, the patients have got a myth, chalta, probably. No, breast cancer is curable if detected in the early stages, and now time has come, even in the advanced stages, we are curing it, but not 100% as it is known as a disease-free survival.
Dr. Faris, also, when a cancer happens to a person, so let's say if a girl or a woman she has cancer in her family, in her mother's or in her grandmother's. So when something like that has already happened in her family, so how can she prepare? How can she prevent it from happening to herself?
See, now what's happened is this is again comes in the breast screening. This is a transmitted disease. If the grandmother the granddaughter has got 2 to 3-fold increase in chances of getting breast cancer. So whenever the mother has got, it's better that the daughter goes and get breast checkup. First and foremost, the most important thing is breast screening. First is the self-breast examination, breast screening, where they do mammography. So once you do the mammography, what happens is the smallest of the smallest lesion, which is kept, that the patient is fixed to the machine and the breast is pulled totally. The nipples and the areolas are pulled totally. It's a very difficult procedure, but it's better you get that mammography done. So once you get the mammography done, you will know the smallest of the smallest swelling in the breast, and it identifies the whole breast and it finds out. And both the breasts they do mammography, and then you'll come to know whether this patient is suffering. Especially this is of very important, very important in case if there is a family history, the mother is suffering, the grandmother is suffering. That is one factor. Now, Angela Jolie, you know very well, she
Yeah.
has done both the breast mastectomy done. That is, she has done for prevention. One breast she got, then she got opposite breast also operated. So now they are doing all this lot of research going on to find out the initial stage, the early stage where there is cure for the breast cancer is 100%. We at BB Cancer Hospital have cured so many, and the disease-free survival is 20 years, 25 years, and the patient dies of heart attack, but not breast cancer.
Doctor, I would also like to know from you, what are the stages of breast cancer? Can you please explain those stages also?
Yeah, I told you, less than 2 centimeters, 2 to 5 centimeters, 5 to centimeters, more than 10 centimeters. So this is
Okay.
1, 2, 3, and 4 stages. Then the spread, it will spread to the lymph node. You examine the axilla, and in the axilla there is a lump, then it has already spread. And then it is in the opposite axilla. Then it is the supraclavicular region. Then it spreads to the liver. These are all advanced stages. Then it goes to the lungs. Then it goes to the brain. We have all types of cases in our hospital. We have seen cancers spreading to the bones as well. What happens is the patient will be walking and suddenly she will develop fractures. So this is known as the pathological fractures. So you have to be careful. You have to identify where the disease is, whether the disease is localized to the breast, or it has spread to the liver, or it has spread to the lungs, or it has spread to the brain, or it has spread to the bones. So when she'll be walking, suddenly she'll fall down. No one knows. Then say, what happened? Some jadoo has happened, they'll be telling. So it is not that. It is known as the pathological fracture, which is very important. And if it spreads to the lungs, the patient will have cough. Again, they will be thinking now COVID is going on. This patient is suffering from corona. No, probably the metastasis has gone to the lung. This is known as the metastatic disease. It goes to the lymph node, it goes to the lungs, it goes to the brain, it goes to the bone, it goes to the liver, and it goes to the ovary, which is known as the Krukenbach's tumors of the ovary.
Also, doctor, are there any particular kind of breast that might develop the breast cancer?
That is, research is going on. Only family history is the most important thing. The most important, through your TV channel, you should tell the patient, please feed the child, please give breast milk. The girls, what they do is they want to keep their breast intact. They want to maintain the shape. That is, the milk factor is the most important cause when they're doing the study for causing the breast cancer. A lady who has delivered a child and breastfed, the chances of breast cancers is very less compared to a girl or a lady who has not breastfed. Studies have shown that breast cancer is more common in the nuns and who don't use the breast for the denuded function of breastfeeding. Breast milk is the best milk where they have colostrum. The moment the mother delivers, the milk comes colostrum. If you feed for the child, that is the best for this thing. It prevents you from a lot of diseases.
So also, doctor, in today's time, women, earlier, it wasn't there earlier as much as it is today in today's time. So what is happening is women are going for, like you said, because of their good shape and their good body, what women are doing is they're going for breast enhancement and breast enhancement surgery, which is also called boob job. So would you say that it is safe or it is risky?
See, God, whatever God has given you, that's the perfect.
Yeah.
All what they are doing is the artificial things that will keep on increasing problem because you are putting a foreign body. You're putting your processes inside. So that causes irritation, and the studies are going on whether this is going to cause cancer, but still is in a trial. So what happens here is, in these cases, the trials are going on, but I would not advise this patient to get this breast augmentation. And that's always, once you put a knife on the patient, definitely they're not going to be all right. That will be temporary, but late consequence is very bad. But still studies are going on to know the percentage of cancer in this breast augmentation and processes which they're using it.
So would you say that all the women who have undergone, the breast enhancement surgery, so would you say that they are having a higher chance of developing the breast cancer in comparison to the ones who have not?
Chances are there because everything artificial, you're putting something inside. You use some foreign body, some materials on your face itself, originality goes. So it is the same thing. You are operating, you're putting an implant inside, and then that becomes a foreign body, and that causes, whenever there's a reaction, the most important cause for the cancer is whenever there's a reaction. For instance, colonic cancer, the patient does not pass motions regularly. That is the most, it causes inside the irritation, and that is the most important cause for the cancer. That is the most important cause.
I had recently read a article. So in that article, it was written that aspirin may help fight aggressive breast cancer by making hard to treat tumors more responsive to anti-cancer drugs. And it is said by the doctors. So would you say it is true or is it false?
The stages of the disease is very, very important for the treatment of the cancer. Number one, once you diagnose cancer, don't think it is cancer. No, there is a cure for cancer. Stage 1 disease, 20 years, patients have survived 25 years and died of heart attack. The most important thing now is we are doing breast conservation surgery. For instance, it is a 2 centimeters. You do a wide local excision. You remove that, and then you are doing an interstitial implant, which is, my brother-in-law has invented a technique by name Syed Nusrath technique. What you do is you just remove the tumor and then put an implant in that and then give radiation for the patient and then follow up the patient whether this patient requires chemotherapy or it does not require chemotherapy. So the treatment for breast cancer is 3. Number 1 is surgery. Number 2 is radiotherapy, and number 3 is chemotherapy. Now, there are so many products which are coming, which are under trial, but I, as a cancer surgeon or a doctor and a qualified doctor who has spent life in the hospitals, we will not encourage this product. Maybe I cannot comment unless and until I see what the product is. It could be a chemotherapeutic agent because there is a lot of revolution in cancer now. Just they give one tablet, costs 1 lakh, 1.5 lakhs, and there is something cured. So that may be there, and they say that this is the thing, and they just get rid of it. Herbs they give. But we have studied, and our teachers are taught, the treatment for cancer is excise that, and then radiotherapy followed by chemotherapy. Depends on the menstruating lady, whether she is in the premenopausal or whether the patient is in the postmenopausal stage.
You already have told that, from the age of 20 to 80, this might happen. But I also would like to again ask from you that does age necessarily plays an important role in breast cancer?
Yes, age they're not sparing. We have seen some girls who are suffering from breast cancer 20 years also. Like what I told you, fibroadenoma. We excised that and it turned out to be a malignancy. Then we did the surgery for that patient. And then, so these are very, very minute differences, You cannot pinpoint, yes, it is not common in the young, but definitely it's not common in the, as the age grows, there is a hormone imbalance. Then the chances of carcinoma is low. And then added to that, this milk factor. You don't breastfeed the milk. And then that is the most important. Then coming to the family history, if the family is suffering from cancer of the breast, then again, there are chances of the child or the mother or the daughter getting cancer of the breast. So breast screening is very, very important.
Dr. Faris, also I would like to know from you, can breast cancer affect the fertility in women?
Well, fertility is a big query and a big question mark. Now, there are research going on that the patient, but it does not go unless and until it goes in the late stage, and then what happens? It goes to the ovaries and the tube, which is known as the Kuchenberg's tumor of the ovary. So in that case, definitely it helps. But there are a lot of research going on to control this, and what they're doing now is They are giving medicine, and then after curing of the patient, the mother is getting pregnant. This is a very, very decimal point of people who are having this infertile, suffering from cancer of the breast.
After a woman have, I mean, after the surgery and after the treatment is successful, so can a woman again go for breast implants after, the cancer has been cured?
You have asked a typical feminine question. Yes.
I mean, women must be searching for this question, I suppose.
Because that is the most important thing for a girl, I totally
Yeah.
agree, with all due respect, yes, we are doing it. And specifically, some patients, what happened, young girls, we feel so bad, young in the sense 25, 30 years, they come. So for them, we remove the whole breast and then we give a prosthesis. So it act exactly like a breast. And then we just fix it with the plastic surgeon. We sit and put a nipple in the areola tissue, but the function of the breast will not be there. But definitely the nature of what has given will be original, and this one which will be given will be artificial. Yes, that's a good question, and they are doing breast implant, following breast surgeries, and then it gives a good shape for the breast. And the ladies having both breasts, she feels happy, she feels comfortable. But the originality will not be there. But still, they are doing implant processes. They are doing to have a good look, so that the lady has got both breasts. But mind you, these people should do a regular follow-up, regular checkup, and especially you have some allergic reactions for this, definitely have to go and consult the treating doctors. What is the cause of the disease? Why the disease? How the patient is suffering from and how is improving. Not that you remove the breast, you put an implant, and you get something else. And in this thing, the most important thing is whenever they excise the cut margins will be very, very important. If at all there is some some tube which is present over there, that will cause more complication for the patient because the patient will have recurrence over there. So the time period will be 6 months after the surgery, which is known as the residual disease, or it is known as the recurrent disease.
So, doctor, also, so are women with heavy breasts more likely to develop breast cancer than, the women who are not having heavy breasts?
Very interesting question. Yes, that's right. That's right. But it's not so. It
Okay,
is
it's
a
not true,
cancer.
you're saying.
Yeah, it is not proven. Breast cancer, you have a big breast or you have a small breast. It is a tumor which comes with this one breast, and then it keeps on becoming increasing in size. Let the size of the breast be bigger and bigger. That will not be a problem. It is not the quantity of the breast which is important for the breast cancer. Even a small breast can have a cancer of the breast. Even a big breast, flabby breast, can have a cancer of the breast. But there is one disease which mimics exactly like that, which is known as the cystosarcoma phyllodes, which becomes a huge breast, huge thing. It looks like cancer, but it is not a cancer. It's a locally malignant disease, cystosarcoma phyllodes.
If breast cancer is, I mean, I think you already have answered this question. So, also, what are the potential risk and side effect of this operation or the surgery, and what can be done to ease the side effects following surgery?
I think you should be given a degree. You have asked me so many questions. Even my postgraduate and doctors, they don't ask. Every surgery has got a complication. The first and foremost, there'll be a bleeding. And then what happens if we remove the breast? So there will be a collection, lymphedema we call, where the limbs become like an elephant. It becomes a bigger in size and we feel bad for it. Because what we do is we go into the axilla and we dissect the lymph node. So that is the most important complication in this one, in the breast cancer. So we have to be very, very careful. You have to explain the patient. Immediately after the surgery, we ask them to do the exercise, combing of the hairs, lifting of the limb, and all that, because it causes lymph edema. Because we are doing the axilla, we're doing the surgery, and we are removing the lymph nodes. Once you remove the lymph nodes, this is one of the complications. Once you do the surgery, you have to keep a good follow-up. And of course, on the local side, there will be a complication. The flap will get necrosed and the patient will have black thing. And then following the radiation, again, the patient will have problem of the chest, it becomes black. And then once the patient takes the chemotherapy, the patient will lose hairs. So she'll be very much upset. So once you give chemotherapy, you should say each hair is going to come back once you're cured of this disease. Hair is not a problem, but you'll be cured from the disease from the bottom of it. So you better have a surgery, better have a radiation therapy, better have a chemotherapy.
A lot of people also, I think they have this idea that before surgery they go for chemotherapy. So would you recommend it, or would you say you should avoid chemotherapy before the surgery?
I don't understand where you're getting these questions from. I have to read the books. Good question. This is known as anterior chemotherapy. What happens is the patient has been given advanced stage 4 disease. So this is a very important question and a tricky question. So once the patient comes, it becomes such a huge tumor, and the maggots comes in from the breast. Very upset to see, maggots just coming out of the. I'm sorry, I don't have a picture. I have shown you. They come out from कीड़े लग रहे हैं बुके बोलते हैं ना, like that. The maggots comes from inside the breast. Very, very difficult situation. So in this case, first and foremost is you clean the maggots and you give chemotherapy. Once you give chemotherapy, what's happened is totally it shrinks and the patient runs off. I'm cured. No, because this is already advanced disease. It must have already gone to the lung. It must have already gone to the liver. It must be going for the brain, waiting to go for the brain. It must be going to the other breast as well and the lymph node. So once it shrinks inside, they run off. No, once it goes off, you have to get a surgery done and then radiotherapy, and then if required, follow up and give chemotherapy. So once they give injection in the form of chemotherapy, it will be in the form of injection. So once you give the injection, totally it becomes smaller in size. Sometimes it disappears also. So they'll say that I'm cured of the breast disease. No, already there will be micrometastatic diseases. When it is in the 4th stage disease, already they'll be spread to the lungs. Already they may be spread to the liver. To prevent this maggots and ulceration and fungation and then problem for the people who are sitting next to you. So it subsides and then you do a surgery, radiotherapy, then the chances of survival is not as good as compared to the stage 1 and the stage 2 disease.
Also, doctor, one last question before I let you go. So what is happening is every minute somewhere in the world, a woman dies from breast cancer. That's more than 1,400 women every day. And whereas a man's lifetime risk of breast cancer is about 1 in 1,000. So why is that?
I'm not going to answer this question. It's a very good question. What happens in the man? Unfortunately, we don't have the breast tissue. The female has the breast tissue. So the moment the man gets a breast cancer, it is stage 4 diseases. Directly it goes to the chest, directly it goes to the ribs, directly it goes to the liver. In that way, the girls and the females are lucky. They have a breast tissue and the growth is very slow. It is better you identify this disease. And in the male, what you say is right. 1% of male carcinoma of the breast are there, but already it is advanced. We had a case of breast cancer where we removed the whole thing, chest, and then finally he went to a lung metastatic disease. So it spread fast. It's a hormonal disease. It spread fast and it becomes a stage 4 disease. And the patient, he dies off. That is the reason females are blessed with that. At least it grows slowly and then the cure is there. But in male, if cancer breast is there, directly it goes into the lungs because there is no other tissue below that.
Yeah. Mm-hmm.
It is the ribs and the lungs.
Thank you so much, Dr. Faris, for coming to SQ TV and speaking with us. And it was such an important subject, and you actually explained it and you educated us, such a beautiful way. So thank you again for doing the show. And
thank you. From my gift, I think from the SQ, I think we'll keep a breast camp so that you can encourage some people. You can call some people. Definitely, I will support a breast camp from your side. Thank you very much.
Thank you so much.
Take care. Stay safe.
All right, guys, that's it from SQ TV. Keep on watching and subscribe to the channel.